Good morning. Wanted to go over some helpful research that I've come across lately. Title is called Physical Therapy, Manual Therapy Referral from Primary Care for Acute Back Pain with Sciatica. So the objective of the study is to evaluate whether an early referral for manual therapy sorts of care reduces disability more than the usual care that patients have gotten with acute sciatica. Usual care being sort of a wait and see, start with over-the-counter NSAIDs. These assessments were done at 4 weeks, 6 months, and 12 months. So important points, just noted as background. Back pain is the second most common reason for visiting a primary care doc, and it's the costliest medical condition in the U.S. Estimated $134 billion spent in 2016. Most sciatica is attributable to lumbar disc disorders, so we got to guard that back. And many persons with acute sciatica have substantial reductions in leg and back pain within a week. But the overall prognosis for low back pain with sciatica is worse than with just purely low back pain. So it's important to get on this, figure it out. They've observed that in primary care settings, 45% of patients with low back pain and sciatica do not have meaningful improvement in disability after a year. And 34% of patients report chronic pain after 2 years. So this is no small deal. Non-steroidal anti-inflammatory drugs are considered the first line of analgesic medication. And they're supposed to consider corticosteroids or weak opioids if those over-the-counter NSAIDs don't work. But the crazy thing about that is this study shows that early mechanical manual interventions are superior to those drugs at 1 month, 6 months, and a year. So you can see where I'm going here. So just as far as what they observed in this study, importantly, is that manual therapy, chiropractic type therapy, and early treatment is going to include not just handheld instruments, but also the manual thrusts, high velocity, so they're not to be worried about. Early treatment, the early treatment group showed greater improvement in disability and back pain across all the follow-up times. Several secondary outcomes also favored early treatment. Patients receiving early treatment were more likely to rate their treatment as successful at 4 weeks and 1 year. Early treatment hastened functional improvement, indicating that early mechanical treatment can be offered as a first line or first option type of care versus the over-the-counter wait and see sort of approach. And then early treatment for recent onset low back pain and sciatica resulted in greater improvement in disability and secondary outcomes than usual care, which is what we were discussing at the 1 year follow-up. So getting on sciatica and low back pain early and effectively with manual type, chiropractic type care shows great promise in function and pain at every stage out to a year. Participants in the early treatment group had greater improvement from baseline to 6 months. And early therapy for recent onset sciatica improved disability and other outcomes compared with just usual care, that wait and see non-prescription medications. So So hopefully you're tracking with me. If you got some bad pain, low back pain with sciatica, the quicker you get on it, the better. And not just from a pain reduction point of view, but with a particular eye to down the road and function and avoiding other episodes. Hopefully this has been helpful. Appreciate your time.